Aloha and welcome to the Future of Senior Fitness. I'm your host, Myles Diaz, Master Trainer and Certified Senior Fitness Specialist. Today we're going to learn about diabetes, a common medical condition that affects many older adults. We will discuss what diabetes is, how it is diagnosed, and the damaging effects that it can cause. Diabetes is a serious disease. People get diabetes when their blood glucose level, sometimes called blood sugar, is too high. Diabetes is a disorder of metabolism, the way the body uses digested food for growth and energy. Diabetes can lead to dangerous health problems, such as having a heart attack or stroke. The good news is that there are things you can do to take control of diabetes and prevent its problems. And if you're worried about getting diabetes, there are things you can do to lower your risk. Diabetes is associated with long-term complications that affect almost every part of the body. The disease often leads to blindness, heart and blood vessel disease, stroke, kidney failure, amputations, and nerve damage. 12.2 million, or 23.1% of all people aged 60 years or older have diabetes. Diabetes is widely recognized as one of the leading causes of death and disability in the United States. In 2006, it was the 7th leading cause of death. However, diabetes is likely to be underreported as the underlying cause of death on death certificates. In 2004, among people ages 65 years or older, heart disease was noted on 68% of diabetes-related death certificates. Stroke was noted on 16% of diabetes-related death certificates for the same age group. In 2012, total diabetes costs in the United States was $245 billion. Indirect costs, including disability payments, time lost from work, and reduced productivity, totaled $69 billion. Direct medical costs for diabetes care, including hospitalization, medical care, treatment supplies, totaled $116 billion. After adjusting for population age and sex differences, average medical expenditures among people diagnosed with diabetes were 2.3 times higher than what expenditures would be in the absence of diabetes. To help us better understand this dangerous disease, we are fortunate to have Dr. Jane Kadohiro join us today. Dr. Kadohiro is the President and CEO of Diabetes Education and Support Consulting Services. She received her doctorate in public health and other education from University of Hawaii and Yale University and has enjoyed a long career as an advanced practice registered nurse and certified diabetes educator. Her 40 years career includes many years as faculty at the University of Hawaii, public health nurse and deputy director of health at the Hawaii State Department of Health, and diabetes nurse educator for the Diabetes Education Center at the Queens Medical Center. Dr. Kadohiro has devoted a great deal of her personal and professional life to making a difference to further developing the profession for diabetes educators in Hawaii, throughout the country, and internationally. In 2010, she was recognized as a Fellow of the American Association of Diabetes Educators for her lifetime contributions to diabetes and for outstanding contributions to diabetes education through clinical practice, research education, and health policy. Doctor, welcome to the Future of Senior Fitness, and thank you for being on the show today.
Thank you, Myles.
Oh, you're welcome. You know, you have a quite unique story to tell. You're someone who's lived with this common medical condition, diabetes, for quite a while now. Why don't we start by you telling us a little bit about yourself and then your involvement with the American Diabetes Association.
Well, yeah, I have lived with type 1 diabetes for 60 years. This is my 60th year. I was a small child, and I'm not going to tell you how old I am.
Okay.
But it has really affected what I chose as my career, and it's my passion to get the word out on how to live healthy with diabetes and how to make it work for you no matter what you do. Nothing should stop you from doing what you want to do. So I went into the health field and have continued. My parents were great, never told me there was anything I couldn't do. So I've tried to put it all in.
Yes. Fabulous. And your work with the American Diabetes Association began?
When I was in the nursing program at UH Manoa back in the 70s, somebody found out I had diabetes, somebody in the community, and invited me to join their group. And I did, and eventually we together formed the American Diabetes Association.
I didn't know that.
And so I've been a very active volunteer with them my entire professional life.
That's very interesting. Now, why all the worry about diabetes lately?
Well, diabetes is very serious. It can lead to all kinds of problems if it's not well taken care of. But even taking care of it is hard work. For some reason, we seem to have an epidemic now, and have over the last decade or so. We have a slide here that really shows the leaps and bounds increases, and this slide only goes up to the year 2011. It's gone way up since then in the last 3 years. In fact, 1 out of 4 people on Medicare have diabetes.
Wow, that is very high.
Yeah.
Okay, and what are the different, what is diabetes? Because I think people really need to know the scientific definition of what it is.
And a lot of people think what it is I ate too much sugar. No, the body's just not handling the sugar or the carbs that turn to sugar. Most all carbs turn to sugar in our bloodstream. So diabetes is really a problem with either not having enough insulin in the body, because insulin is what turns our glucose into hiding it into the cells or feeding the cells with energy, or there may be actually enough insulin to do its job, but the cells are not accepting it, so it's not working properly.
Okay, and that's where we get into the different types of diabetes, right?
Exactly.
Type 1 and type 2.
Exactly.
So to let us know what the different types are.
So actually type 1 diabetes, and only about 5% of everybody with diabetes have type 1. That's my type diabetes.
Right, people are pretty much born with it, right?
Well, you're born certainly with the genetics, and then it may show itself, if you will, usually in childhood, but it can occur in mid-age or older age adults. Type 1 is a matter of the pancreas just stops, the insulin producing part stop working. So there's not any insulin within the first 6 months to a year of being diagnosed with type 1. Type 2 diabetes, on the other hand, it's a little different. We've got all these risk factors that we'll talk about, but eventually that you may even have enough insulin, but it's not doing its job properly. Type 1 diabetes is an autoimmune problem. Something within the body attacks the insulin-producing cells, the beta cells, and boom, it's not there anymore. So that person has to take insulin shots the whole rest of their lives. Type 2 diabetes, there may not be quite enough insulin, and it might need some help, but often there's even enough insulin early on with type 2, but it's just not working properly. So if we look at this slide with the octet, we call it, the ominous octet, it shows all the different parts of the body that can really, with type 2 diabetes, that can be the problem. And different medicines for type 2 diabetes work with one or the other of these different things, different body parts, if you will, or body organs. Unfortunately, there's no easy blood test to say, you have type 2 diabetes. There is a blood test to say, maybe you have type 1 diabetes, but that's not used very often. And so we really base it on how a person presents to the doctor, and if the blood sugar is elevated and a person has most of the risk factors for type 2 diabetes, they'll automatically be diagnosed with type 2. But often they're not automatically given the blood tests that would say that I have type 1.
So let's talk about how diabetes is diagnosed.
Okay. You usually will diagnose diabetes even if you don't have symptoms. By age 45, everybody should have a blood test, even if they have no risk factors. And that blood test is usually a fasting blood sugar. That means you haven't eaten for 8 to 12 hours. And the number would come out 126 or above as a fasting blood sugar. On our chart here, it shows FBG, fasting blood glucose. So 126 or above. Whether it's type 1 or type 2, it's diabetes. And so that we then is one way to diagnose diabetes. But about 5 years ago or so, there was another test done to see if people who have diabetes have their blood sugar in really good control. But it wasn't used to diagnose diabetes. It's a test called A1C. It's basically, to make a long story short, it gives us an idea over the last 3 months, how's your average blood sugar been 24/7? So instead of a fasting blood sugar that tells you right now at this point in time, here's what my number is, this one gives you an average picture for 3 whole months. And to diagnose diabetes with an A1C, it's 6.5 or above. So often, if one or the other of those numbers, the fasting blood sugar or the A1C, is elevated or in the diagnostic range, some doctors will ask you to come back for another test just to validate, verify that. But we technically can diagnose with just that one number.
So that's definitely will raise the red flag.
That's right. Every now and then, if a person might just have a random blood test anytime during the day. Right now, nobody told you to not eat anything and you just ate. If that's 200 or above, you're going to be told to go for more tests because that's way too high.
Who gets diabetes?
Well, big factor is if it runs in the family, you are at big risk. So definitely that's something we can't make many changes about. We're born into the family we're born into.
So genetics.
Genetics, big one. But after that, for type 2 diabetes, certainly having, in addition to the family history, being overweight, being inactive in our day-to-day lives, which also often will lead to overweight, having an unhealthy diet, having a high stress life. Those can all really be huge risk factors for diabetes. People who have high blood pressure, high cholesterol, those are often part of the risks as well. Women who have given birth to large babies, and we're talking 9 pounds or over, they're very much at risk of developing diabetes later. And if they've had gestational diabetes during their pregnancy, definitely they should be tested every 1 to 3 years. Certainly after baby is born and again that next year, but they should be on a regular routine to be tested. Who gets type 1 diabetes? We know there is a genetic component to that as well. It's not quite as strongly hereditary as type 2, but in addition to that, we don't have all the science. And so we need a lot more research in type 1 for sure, but also in type 2 diabetes.
Okay. Well, those things that you mentioned about high blood pressure, cholesterol levels, that would explain why it kind of is more prevalent in people who are 60 years and older, right? Although we all know now that it is affecting our youth. But these things that build to it, is that why it is, for people usually 60 years and older?
Right, and really we're talking about the high blood pressure and high blood cholesterol and the overweight. all of those kind of factors are part of what we call the metabolic syndrome. And that really is part of what then has come to be called prediabetes often. And often when you have those things and some genetics, boom, before you know it, you've got prediabetes. And then if something isn't done to hold that in line, it usually will advance on to full-on diabetes. However, we learned from some very good research, diabetes prevention program, that even if we have prediabetes, if we can really get on a good course of exercise for a lifetime, and we call it physical activity or just keeping active.
Right. Things like taking the stairs, parking your car farther away.
Exactly.
Right.
And really trying to adopt healthier eating habits. And you don't need to lose back to your high school weight, but getting some of that down, we can really prevent it from moving on to full-on diabetes, or at least we can long-term delay it.
Okay, so this is very important. Good information. That's what everybody needs to know. And we're going to talk more about prediabetes coming up. But before we do, what are the damaging effects of diabetes?
Well, and we say it's the damaging effects of diabetes, but it's really the damaging effects of uncontrolled high blood sugar or uncontrolled diabetes. If a person keeps their blood sugar in really good shape, they are most likely not going to experience some of those long-term complications. That's the good news. If a person has uncontrolled high blood sugar over time, not just one number that's off the chart or a couple of days of being sick and maybe your numbers went crazy, but over time having high blood sugar can lead to what we call small blood vessel complications. Eyes are damaged, the kidneys are damaged, leading to dialysis and transplants. Certainly with the eyes, it's the small vessels in the back of the eyes that can lead to blindness, vision impairment, and eventual blindness. And again, these are if something's not done. Being screened for these early can really make a big difference. But the large vessel complications include your heart disease, heart attacks, strokes, and certainly the larger vessels leading to the feet can add to the huge risk of amputations together with poor circulation. So those with uncontrolled high blood sugar are huge issues. The whole nervous system can be affected as well as all the blood vessels. So even though I've mentioned just about 5 or 6 body parts right now, it's all the organs can be affected.
I remember reading something about the death certificates sometimes really don't show that it's diabetes, right?
That's right.
Underlying reporting factors sometimes are heart failure or heart disease or stroke or something else, right?
They had the diabetes that led them to develop the uncontrolled diabetes.
So probably even with these statistics that we're talking about, could be
It's
even
way worse. Way worse. We also know probably with the numbers that we throw out every time surveys are done, how many people have diabetes. We're only really saying probably another third or another quarter as much have undiagnosed diabetes. They're walking around with it but don't know they have it. So very important to be screened for diabetes on a regular basis, and particularly if you've got it in the family. But screening alone isn't enough. It's adopting those healthy lifestyles.
Let's talk about what prediabetes is.
Okay, and we did kind of talk about this a little bit. But with prediabetes, it's any blood sugar from 100 to 125.
Okay.
That's the magic number that you'll come up with. Or that A1C test, that average over 3 months, between 5.7 to 6.4. That's in the prediabetes range. But what leads to it is kind of the things that lead to ultimately to diabetes. It's the family history, the usually overweight, the high blood pressure, the high blood cholesterol. The one I didn't mention is called central obesity.
Okay.
Many people have heard about the apple and the pear shape.
Yeah, right.
So this is your apple-shaped person where most of their weight is in the gut. They may have nice thin legs and but a big opu. So so
They're
very
more predisposed, right?
more predisposed. And you know, a lot of us don't have a whole lot of control over our body shape. Some of that's hereditary to begin with, but certainly we can do other things, lifestyle, to keep it in bounds.
I want to ask this question. Is there something, if I was walking around, I could tell that I might have diabetes? Or is it just the fact that, hey, my blood pressure is high, you know, I have these other things, this metabolic syndrome. Maybe, just maybe, I might be someone who needs to run in there and take a test.
Well, if you've got it in the family, that's a good reason to just take a test at least every actually, they're now recommending every year if you've got any of the, not symptoms, but any of the huge risk factors and symptoms. What might some of the symptoms be? Sometimes people will feel extra tired, but we sort of pawn that off because it's like, oh, I work hard, I'm tired, I stayed up late last night. A lot of times it'll be, I've started getting up in the middle of the night to go to the bathroom a couple times, going to the bathroom too much, being really, really thirsty, but then we've lived through a horrible summer. It's been brutal. And so we pawn those things off as well.
Dehydration.
Exactly. Dry, itchy skin or wounds or little scratches that turn a little infected or get red, won't heal. That's a huge sign or a huge, time to do something about it. Look into it.
Okay. Now, can diabetes and or prediabetes be reversed?
You know, I get asked that question all the time. No. No, no, no. However, it can be controlled. And one of the issues that have come up a lot is we'll tell somebody they've done a great job. They were diagnosed with diabetes, and they really got with the program. They lost some weight. They started a really good exercise program. They may have been put on a medication that was really effective, and by golly, their numbers are all in the no diabetes range. However, if we tell them you have no diabetes, the human thing most people will do is start to resort back to those other lifestyle things. So no, you can't cure it. You can't. You can reverse it with the treatment. A lot of people will say, "Well, I used to have diabetes, but I don't anymore." But are you still watching your food intake? Maybe you got off your medication, but you still need to watch what you're eating and your activity and your stress management, those kind of things. And you need to monitor it every now and then to make sure it's not creeping back.
Okay, and that's true for both people who have it already and prediabetes.
Exactly.
Okay, great. Well, now that we know about diabetes, we need to learn different strategies to manage this disease. Doctor, would you be willing to come back for a second episode and be able to discuss how people that are afflicted with this disease can better manage it?
Be happy to do that.
Great. Thank you again for being on the show today, and I look forward to our next episode on diabetes. Until then, this is Myles Diaz wishing you the best in health and reminding you that health is your only wealth.